So as much as we would like to pass this condition off to the men only, snoring can also have an impact on a woman's health. Dr. Craig Schwimmer, medical director at the Snoring Center, is here to talk about the effects of snoring in women. Now, absolutely. I don't snore.
I'm not going to argue with you. I believe you.
Very good. You're a wise man. You must be married.
Yes, of course.
Okay. So are there effects of snoring in women that are similar to men?
Absolutely. And really the global issue is that snoring and sleep apnea, sleep-disordered breathing, are conditions that impact women as well. Mm-hmm. You know, typically when we talk about these subjects, we're always focused on the man.
Yeah.
And that can have some serious consequences because women with sleep-disordered breathing often don't get diagnosed and therefore don't get treated.
Mm-hmm. Similar to like what heart disease was 10 years ago.
Exactly, exactly. It was a big problem. 10, 15 years ago, women would have chest pain and doctors wouldn't think, oh, maybe they're having a heart attack, because we didn't think of heart disease in women. Mm-hmm. And very similarly now, when women go to their doctor and complain about fatigue or poor sleep quality, it is much more likely that they are diagnosed as being depressed and giving an antidepressant or sort of blown off, frankly, than if a middle-aged man comes in and voices those same complaints, because there's enough awareness now for men that the doctor will say, oh, he's a middle-aged man and he's complaining about his sleep. Maybe he's got sleep apnea. Let's look into that. And the woman may not get that same degree of attention because there's not that same amount of awareness, and that's a problem.
What conditions are usually present for the woman who has a problem with snoring?
Well, again, same presenting signs and symptoms of poor sleep quality, excessive daytime sleepiness, often decreased mood. So the similar spectrum of signs and symptoms, but they're often undiagnosed because they're not at the forefront often of people's minds. But
the person who just had a baby might have a problem.
Well, there certainly are some unique conditions. Women with sleep apnea who are pregnant appear to be at an increased risk for gestational diabetes, as well as preeclampsia, a condition of hypertension associated with pregnancy. And so certainly for women who are pregnant, diagnosing sleep-disordered breathing is essential.
And there is great concern if this is not treated.
Absolutely, because women suffer the same health consequences as men do. So there's an increased risk of high blood pressure and stroke and heart attack, as well as automobile and workplace accidents. So the consequences are the same. The issue is that because of less awareness, there's less diagnosis, but some estimates say that up to 9% of adult women have sleep apnea.
Really?
Yeah.
So are there any other more serious concerns that we should consider as women who suffer with snoring problems?
Well, I think it's like many things in American medicine now. There's a need for patients to sort of take things into their own hands and present things to their physicians and engage their physicians. So if you're a woman and your husband tells you that you snore, or you have concerns about your sleep, you have daytime sleepiness, or you've been diagnosed with a mood disorder, and you have questions about your sleep, I think that it's clearly worthwhile to raise the issue of sleep with your doctor and say, hey doc, could my sleep be impacting this?
I have to tell you, I had a facial yesterday, and I woke myself up snoring while there on the table getting my facial. So, okay, sometimes I do snore.
It happens
but
to the best
it's not
of us.
Always the woman. So what happens when it's the man who's doing the snoring?
Well, again, it's our fault. And most commonly it is. It's more common amongst men than it is in women. But if you are a woman and you're sleeping next to a snorer, you're getting less sleep.
Yeah, that's true.
So bed partners of snorers on average get an hour less sleep per night. And when men come in and say, well, it's not a big deal, I say, you know what, if you were sleeping next to somebody who are learning how to play the saxophone at night, it would be an issue for you. Anything that disturbs the bed partner's sleep is an issue, and snoring is certainly one of those things.
So kick him out of the bed.
Well, no, fix his snoring.
Fix his snoring. Okay, it's an easier solution.
Exactly.
Thanks so much, Dr. Schwimmer. If you need help with your snoring, contact Dr. Schwimmer. The Snoring Center has offices in Dallas and Fort Worth. Just log on to snoringcenter.com for more information. Up next, ideas for beating the summer boredom blues. Stay with us.